Stephanie.
Hi.
I'm an FNP student at Mass College of Pharmacy, and I'll be
Okay.
doing your assessment today.
Great.
Okay, I'm just going to wash my hands
Okay.
over here. Okay,
Mhm.
quickly. And dry them. Okay, well, it's nice to meet you.
Nice to meet you too.
So what brings you here today?
Just an annual checkup.
Okay, great. Well, I appreciate you letting me do this.
Of course.
What I'm going to be doing is assessing your head and neck,
Okay.
your face,
Mhm.
your eyes, nose, mouth, and your ears.
Okay.
Okay, so I'm going to first start just asking you a few questions. Can you tell me your full name?
Erica Lazard,
Okay, and what's your date of birth?
3/1/88,
Okay, and what's today's date?
January 28th, 2013.
Okay, and where are you today?
The health clinic.
Great.
Okay.
Perfect. Okay, so I'm just going to take a look at your skin.
Okay.
Okay, just seeing the color, the pigmentation is a tannish pink color even throughout. There's no bruising or lesions or scars that I really see that's open or risk for infection. Have you had any problems with your skin?
Nope.
Okay, it looks good. Looks like you keep it nice and hydrated.
Mm-hmm.
All right, so I'm just going to check the temperature.
Okay.
Okay, warm. Good. Very good. And the turgor of your skin.
Okay.
All right, perfect. So it's coming back very nicely.
Okay.
All right, so also going to just inspect your eyes for the symmetry, which they look very symmetrical to me, and your ears as well.
Mm-hmm.
Seated in good position.
Mhm.
You've got the vellus hair on your face, and I'm just going to check the terminal hair on your head and your eyebrows and your eyelashes as well. So I'm just going to actually palpate your scalp for any lesions or abnormal bumps. Have you had any problems with your scalp at all?
No.
Okay, so let me just feel the bones behind here. Let me know if it's painful at all.
Okay.
And your hair is a blonde, thick set of hair. It's nice and shiny and looks healthy.
Great.
Okay, any pain there at all?
Nope.
Wonderful. Thank you. Okay, so I'm actually going to just test a few of the cranial nerves.
Mhm.
I'll start with cranial nerve 7, which is the facial nerve,
Okay.
and cranial nerve 12, which is the hypoglossal nerve.
Okay.
Okay, so I'm just going to have you follow a few of the steps. So
Mhm.
what I'll have you do is squeeze your eyes shut, okay, and then raise your eyebrows, good, and then frown, smile, good, stick your tongue out, and puff your cheeks out. Good, so everything's equal, as your eyebrows are moving appropriately bilaterally, so it's very symmetrical. And then I'm going to test cranial nerve 5, which is the trigeminal nerve.
Mhm.
So what I'm going to have you do is try to open your chin here. Good, perfect. And then I'm going to also test the spinal nerve, which is cranial nerve 11.
Mm-hmm.
So if you shrug your shoulders up for me, don't let me push them down. Good, perfect. And I'm going to come behind you and turn your head to the left. Perfect. And don't let me push your head to the midline. Good. And the same on the other side. Don't let me push. Perfect. Okay, great. So I'm going to move on to inspect your eyes a little bit more. Just taking a good look at it. Your eyes look, the eyeballs look nice and moist and healthy. You don't really have any redness or swelling. There's no swelling at all or drainage noted. I am going to take a closer look at your conjunctiva, sclera, and your iris. So if you could just look up for me. Perfect. So the conjunctiva is nice and clear. Sclera is white, and your iris are both brown, oval, and flat, and they look nice and healthy. Minimal blood vessels, but it's pretty clear. So I'm just going to take a closer look at your eyeballs. If you look down for me. Good. Okay. And I'm also going to palpate your lacrimal apparatus just to monitor or test for any blockages in the tear ducts. So if you just kind of relax for a minute. Is this painful? Keep your
No.
eyes open.
No.
Any pain here?
No.
Okay, good. Good. So why don't we start testing cranial nerve 2, which is the optic nerve. And what I'm going to have you do is keep this eye chart about 14 inches from you, and with one eye blocked, read the smallest line that you can possibly read. So this
Okay.
is about so cover one eye, and this is about 14 inches here. So if you could read for me the lowest line.
42873.
Okay, great. And then we'll do the same on the other side.
428739.
Okay, great. So that's 20/20 vision. Great, excellent. So now I am going to test your eye reflexes. So I'm just going to dim the lights momentarily. Okay, and just using my pen light, I'm going to have you keep your eye focused on this ear right here, okay? Okay, good direct reflexes. And then same one, focus on this ear over here. All right, good consensual reflexes. Great. So I'm going to have you focus on my pen, and as I come closer, just keep your eyes on the pen, okay? Perfect. So your eyes your pupils are constricting appropriately and following the light appropriately.
Okay.
So your eyes are, reactive, and there's positive accommodation as well.
Okay.
So let me turn the lights back on. Okay. And this light too? Okay, perfect. Okay. So I guess the next step, we'll test another set of cranial nerves. Cranial nerve 3, the oculomotor nerve, cranial nerve 4, the cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve. Okay, so that's testing the extraocular eye movement and convergence.
Okay.
So I'm going to have you just keep your head nice and still and look directly at me for now, and then you'll follow my finger as I move it. Okay, so to the left, laterally, okay, and up, okay, to the right, down, okay, and again we'll go up and to the right, and down, and up, and to the left, and down. Okay, good, very good. So everything looks good there. I'm going to also check the confrontation test. So both of us will use this eye chart to block our eyes, and I'll have you block your right eye, and I'll block my left, and just let me know when you see my finger in your peripheral field of vision.
Now.
Good.
Right now.
Okay,
Now.
good, and
Now.
good. And then we'll switch eyes and do the same thing. Okay,
Now.
good,
Now.
good,
Now.
good, and
Now.
good. Perfect. Okay, so I can take this from you.
Okay.
So I am going to take a closer look at your eyes.
Mhm.
So actually, if you just stare directly at me, and I'm just going to come a little bit closer. Okay. So I see a positive red reflex,
Mhm.
and as I get closer here, I see the optic disc is a creamy yellow in color, and the arteries and veins and all 4 quadrants surrounding it. And the arteries are a little bit darker red than the veins and a little bit thinner.
Okay.
And then the macula is 2 dBs away from the optic disc, and it's a darker color than the fundus and homogeneous. So I just want to take a look at the other eye and just make sure that everything looks good.
Mhm.
Very light reflex. Good. Very good.
Okay.
Okay. So moving on to your ears. I'm just going to take a nice look at the skin. I don't see any lesions or bumps, or have you had any problems with your ears?
Nope.
Okay, there's no fluid or anything that's coming out of the ears. It's nice and pink, matches the color of your skin. There's no moisture, and the rest of your skin has been, no moisture either.
No. Nothing.
Okay, so what I'll do is I'll start testing the acoustic nerve, cranial nerve 8.
Okay.
So what I'm going to have you do is kind of put pressure on your tragus here, which is this right here, and press in and out. I'll be over here and I'll say 3 different letters and just repeat after me.
Okay.
Okay. C,
C.
E,
E.
F, F. Okay, good. And we'll do the other side as well. G,
G.
L,
L.
D.
D.
Good. Excellent. Very good. Okay, so now I am going to check the Renee test using this tuning fork. And what I'll have you do is let me know when, if A or B is louder, okay? A or B?
A.
Good. To the other side.
Okay.
A or B?
A.
Perfect. And then the Weber test, let me know if the right ear, the left ear, or in the middle is where you hear it the
Okay.
best. Okay, ready?
The middle.
Good. Excellent. Very good. So I am going to take a closer look into your ears.
Okay.
Okay, so if you could tilt your head to the left and down a little bit. Okay, ears look good, very clean, a slight bit of yellow wax, but very minimal. Hair looks clean, no foreign bodies in there, no swelling, drainage, bleeding noted. As I get a little bit closer to your tympanic membrane, it's a pearly gray, clear color, looks good. Great. Let me just check the other one. Okay. And your head, tilt your head a little bit. Okay, and no drainage over here. Tympanic membrane looks good. Optic, the light disc is on the left ear, it's at 7 o'clock, and I noticed on the right ear it was at 5 o'clock.
Okay.
So otherwise looks
And that's
good.
normal?
That's normal.
Okay.
Yes. And I'm also going to take a look at your fingers too while I have you here.
Okay.
The skin, oh, you're a little moist, but I think it's just nerves. Skin looks good, pink, even. Cuticles are clean. Hands are very clean and well groomed. Nail beds are pink. The angle is at 160, which is very normal.
Okay.
There's no tearing or no risk for infection that I see here. Looks like you take good care of your nails. And I'm just going to check the capillary refill.
Okay.
Okay. Which is instant, and on this side too. Okay, good,
right.
excellent. So, moving on to your nose. Nose sits symmetrically. Everything looks good there. Have you had any issues with your nose, abnormal
No.
drainage or anything like that?
Everything good.
Okay, good. So I'm actually going to just take a close look into your nose.
Okay.
See, smaller one. Okay. Okay, looks nice and clean. Good. So the septum is not deviated. It's nice and pink. Inside. Looks good. Okay. Very good.
All right.
And I'm just going to actually test cranial nerve number one, the olfactory nerve.
Okay.
So I'll have you close your eyes for now,
Okay.
and then shutting one nostril. Please tell me what you smell.
Farm food.
Good. And with the other nostril shut, I'm just going to have you tell me what you smell.
Ketchup.
Perfect.
Okay.
Perfect. So I'm also going to just palpate your maxillary sinuses and your temporomandibular sinuses. Any pain?
Nope.
Any pain?
Nope.
Good. Excellent. All right, and actually I will do the check cranial nerve number 5 again, the trigeminal nerve,
Okay.
to test for sensation with your face.
Okay.
So please tell me if you feel a sharp or a dull sensation
Okay.
closing your eyes, okay?
Sharp.
Okay. Dull.
Sharp.
Sharp. Dull. Good.
Okay.
All right, so now, last but not least, I will inspect your mouth.
Okay.
Okay, so the mouth looks good, pink, moist, I see a little bit of a scar there, is that
I got a burn.
Oh, you-
Burn.
from the sun?
Sunburn.
Oh, okay, well, do you wear sunscreen?
I do.
now? Okay, make sure you wear
I
sunscreen.
learned my lesson.
Good, good. There's no lesions or anything like that, otherwise no
No.
cracking noted or anything like
No.
that. Good, so, actually, if you could just open up your mouth and clench your teeth together. Okay, great, your teeth look white and straight, and, looks like you probably had some braces. Looks good, and you take good care of it, no missing teeth, no, debris or anything like that,
No.
great. I'm just gonna take a look at your gums.
Okay.
Okay, good. Mouth is pink, no, there isn't a, receding gum line or anything.
Okay, good.
Okay, so actually, put my gloves on just to inspect a little bit closer. Okay, the inside of your cheeks. Okay, mucosal lining is nice and pink and moist. Any pain? Don't see any
No.
cuts or lesions or anything like that. What I'll have you do is stick your tongue out for me.
Okay.
Okay, I'm just gonna hold on to it.
Uh-huh.
Okay, and then on the other side too, just checking for any white marks or lumps. Good. Lift your tongue all the way up. Okay, it's nice and moist. You've got good veins there as well. I'm sorry, sorry. Dry, sorry. Okay, looks good. Nice and clean, and then stick your tongue out all the way. Okay, and it's also nice and moist too, a little bit more bumpy but from the palate. Okay, so that's good. Actually, if you open up your mouth nice and wide, I'm going to just check your soft and hard palate.
Okay.
Okay. All right, so the hard palate, it's a slightly whiter with some ridges, just harder, and then the soft palate looks good, it's a little bit more pink.
Okay.
Okay. Now I am going to test cranial nerve number 9, cranial nerve number 9, cranial nerve number 10, the vagus, and cranial nerve number 12, the hypoglossal.
Okay.
And so what I will have you do is open up your mouth for me,
Okay.
just to check your uvula. Okay, and say ah. Perfect. Looks good. Okay, good.
Okay.
Okay, and I can also see your tonsils back there. They look nice and pink, 1+ tonsils, I would rate them. Looks very healthy. The anterior and posterior fissures, as well as the posterior pharynx, also look nice and healthy.
Okay.
Okay, so I'm going to have you just swallow for me. Any pain or pressure when you swallow?
Nope.
Okay, good. And then I'm going to actually just palpate your trachea.
Okay.
So it's nice and midline, symmetrical, no deviations as I press. So it looks good. Very good. And last but not least, I'm just going to palpate your thyroid gland.
Okay.
So I'm just going to come behind you. I'll have you turn your head to the right for me, okay? And just going to move and please swallow. And to the left, same thing. Okay, so there's no lumps or anything. It's no enlargement. It feels very healthy. So
Sound healthy?
you look great,
Okay.
yeah, and very nice to meet you.
Nice
and
to meet
take
you too.
care.
Thank
Okay,
you.
Have a good day.
You too.